Good afternoon. My name is Jim Blando, and I'm a faculty member at Old Dominion University in Norfolk, Virginia. And I'm just going to do a very brief discussion about how uncertainty influences decisions that one would make with regard to exposure and risk management. Uncertainty is a very important component of making those decisions. And it's important that we understand how we can utilize this, our assessment of uncertainty in terms of making effective decisions. So uncertainty exists, of course, in all exposure and risk assessments. We always have random error. We hopefully, very likely have systematic error to some extent. Hopefully we can reduce the amount of systematic error that we have in our assessments. And bias also can exist to some extent. Hopefully we can reduce the bias in our assessments as much as possible as well. It's important for us to think about this in our assessments because this is going to impact the risk management decisions we would make. I also do want to quickly say that this module, I'm only describing uncertainty in terms of risk management and decision-making in a very brief way. Other modules that exist on the PocketMap website give very significant details on how to calculate and quantify uncertainty. That is not the purpose of this module. The purpose of this module is just really briefly discuss with you how uncertainty in a qualitative way can impact your risk management decisions. As I mentioned already, random error, systematic error, and bias exist to some extent. Hopefully we can minimize them as much as possible. However, regardless of our attempts to minimize them, likely there is some potential to have these in all assessments, which are going to impact our management decisions. All data has some inherent uncertainty. And I would also say that it's important for us to realize that unlike some other disciplines, in environmental and occupational health, we typically find that oftentimes, more often than not, the data we have available is not ideal. Usually, as some people refer to, there's dirt in the data. Oftentimes, the data we have is less than ideal, and therefore that makes this assessment from a qualitative standpoint or a quantitative standpoint very important for us to consider when we're making management decisions. There are lots of tools to assess uncertainty, statistical techniques, propagation of error, sensitivity analysis certainly exists. Some of the other modules in PocketMap discuss this in more detail. I'm not really going to discuss this here, but just want to reference the fact that there are statistical ways that you can look at things quantitatively. Also, professional judgment can be very important. Just having experience and utilizing that professional judgment to make decisions about how the uncertainty is going to impact your decisions can be very, very useful. It is definitely subject to the experience of the individual utilizing professional judgment, but still can be very useful. And certainly, if multiple studies and tests exist, I can look at variances between the different studies and tests to give me some assessment as to what uncertainty I might expect. So the key point I want to make in this module really is to just quickly talk about the precautionary principle, right? And what this is this is a recognition that sometimes we have uncertainty, and due to that uncertainty, we have a lack of knowledge and a lack of full awareness about the risks involved. When information is lacking, the precautionary principle states that we're going to be more careful. We're going to put more precautions in place because we don't fully know how to assess the risk. And just in case the risk is more severe than we would have originally thought, we want to have some extra precautions in place. It's sort of that just in case idea. And this is important for us to do. We want to have a proper, what oftentimes referred to as a margin of safety. We want to give ourselves a little bit of wiggle room just in case the uncertainty is such that we don't fully understand the risks that are involved. It's kind of a better safe than sorry concept. So we do want to think about that. The reason why I have the anthrax slide here, this is a slide of when we had to enter the Hamilton post office to collect samples to determine how much anthrax spore contamination there was in the Hamilton Township mail facility. There was a lot that wasn't known. We knew anthrax was bad. We knew that anthrax could result in really severe disease. We didn't know much about the spores or how easily airborne those spores are. So we knew that in nature, oftentimes anthrax is cutaneous and not airborne, but we didn't know in the post office if these spores were formed in a different manner or sporulated in a different manner, whether they could be airborne or not. But because of the severity of the disease that could result from exposure, we went full tilt, full gear, completely encapsulating gear with SCBAs, the highest level of protection we could give our guys, just in case the spores could become airborne. And it turns out, after we collected our samples, we found that, in fact, the individual who committed this terroristic incident actually did sporulate the spores in a manner that made these spores very easily airborne. So it was good that we utilized a precautionary principle and protected our guys just in case, because it turned out in this particular terroristic incident in 2001, it turns out that these spores were very easily able to become airborne, unlike what we usually see in nature when animals contract anthrax. So this is an example of thinking about the precautionary principle. We have uncertainty just in case. Because of that uncertainty, we're going to take a more conservative, careful approach. This is also important because, as in this picture demonstrates, this example with anthrax demonstrates, different control measures afford different levels of protection. An example of that could be respirator protection factors. So again, that's from a public health perspective, how we try to address this. We utilize a precautionary principle. Sometimes this comes in conflict with business interests because a precautionary principle sometimes could result in having to do more or more expenses, and sometimes business interests will push back. And that's something that oftentimes has to be negotiated and worked out to some reasonable conclusion. From a public health perspective, our main concern is public health protection, and that's where we tend to focus. Conclusion: when uncertainty in exposure or risk assessment increases, control measures employed should be more cautious and assure a wider margin of safety. Exposure assessments and risk assessments are tools and thus subject to errors and assumptions that are made. This is why we have to be very careful about uncertainty. And to guard against potential systematic areas, we want to certainly employ the precautionary principle. And again, another saying that is oftentimes used: an ounce of prevention is worth a pound of cure. And I think that's applicable here, especially when we think about uncertainty. When we have more certainty, that's where we have the ability to be a little bit less conservative. But when we have a lot of uncertainty, we have to be conservative. And that is how uncertainty is going to influence our risk and exposure management decisions. And thank you very much for your time.